A warm welcome to everybody who's joining us today. We will wait another minute or two to allow our other participants to join, and then we will get started. Right, good day to everybody, wherever you are in the world. Welcome to this event. This is the last event in the WHO Religions for Peace Global Conference, entitled Strengthening National Responses to Health Emergencies, WHO, religious leaders, faith-based organizations, faith communities, and national governments. We're delighted to have you with us here today, and if you've been following us over the course of October, November, and now into December, welcome back, and thank you to everybody for the support. The topic of today's webinar is a very important one, particularly in the current context of the COVID-19 pandemic: building trust, religious leaders' engagement in vaccine confidence. And we have a wonderful set of panelists here today to share with us their expertise, their knowledge, and their experience. Before we start, I would like to hand over to our co-host, Dipika Singh from Religions for Peace. Thank you so much, Dipika, for all the wonderful collaboration to date. Over to you.
Thank you so much, Sarah. Good morning, good afternoon, and good evening to all. I join Sarah in welcoming you all to this session on, as Sarah mentioned, building trust, religious leaders' engagement in vaccine confidence. My name is Dipika Singh, and I serve as the Associate Secretary General and the Director of Programs at Religions for Peace, which is one of the largest multi-religious movement with interreligious councils and along with women of faith networks and interfaith youth networks in over 90 countries across the world. We're so very delighted to be partnering with WHO to co-host this important global conference. As you know, for centuries, religious leaders, institutions, and faith-based organizations have been the first responders and have played and are playing a critical role in responding to crisis and addressing the needs of the people, particularly the most vulnerable. You know that religious leaders and institutions are frequently a trusted entity within a community. With their more authority, their extraordinary reach, access, credibility, network, and resources, faith leaders can influence thinking and attitudes, promote dialogues, and set priorities for members of their communities. This actually enables them to make valuable contributions in addressing the challenges facing the communities, in changing behaviors and mounting an effective response to health issues such as the one we are facing now. And when diverse religious communities come together, multi-religious efforts can be more powerful than the efforts of individual religious groups acting alone. We have observed how rampant myths, miscommunication, and rumors have become such a challenge and barrier to effectively addressing COVID. These have also led people to lose trust in COVID vaccines and science itself, actually. And religious leaders and institutions can address these and ensure that their followers and communities have the right information. And we're most fortunate that we have here today with us outstanding experts and leaders who will share their experiences and knowledge on faith engagement and building vaccine confidence. However, before we start, as we do at Religious of Peace, let us observe a moment of silence for all the lives that have been lost and for all those who have been and are still continuing to be affected by COVID-19. So let us observe a moment of silence, please. Thank you so much. Now I have the pleasure of handing over to our facilitator, Rabbi Gustavo Kraselnik, who is the spiritual leader of the congregation for Shearith, Israel in Panama, and the executive director of the Panamanian Jewish Congress. He's also a member of the Interfaith Committee of Panama. Rabbi Gustavo, over to you.
Thank you. Thank you very much, Dipika. Thank you very much, WHO and Religion for Peace. It's a great honor to be the facilitator in this important webinar. Regards everyone from Panama. Good morning here, and wherever you want, good afternoon, good night, who knows. I think that it's very important to be together and discuss these issues. The Jewish people is celebrating Hanukkah, the festival of lights. We light a candle, bring more light to the world, and I'm sure that we'll be enlightened after this important discussion. So each speaker will have 5 minutes to answer questions, and then I have a question for all the speakers, and then we have a Q&A moment. So remember to send questions through the chat. Okay, so let's start with our first panelist. We are moving to Nigeria. I want to welcome Sister Agatha Chikelwe, Executive Director of Cardinal Onayekan Foundation for Peace and Chair of Religion for Peace International Women's Coordinating Committee. Sister, welcome very much. My question for you, how was working on an interfaith base been helpful in addressing trust in vaccine, and to what extent does your community need to have an in-house discussion before going into discussion on sensitive issues with others? Sister, welcome.
Thank you very much, Gustavo. And thank you, Religions for Peace and World Health Organization, for bringing together this beautiful program. Let me go straight to the question by responding that, as far as I'm concerned, religious organization is one of the best platforms that can be used to address any good thing, and somehow, and unfortunately, somehow bad things too. And COVID-19 is one of the issues that can effectively be addressed through the form of interfaith organizations and interfaith basis. You know why? Because the COVID-19 pandemic that we have all suffered since last year is no respecter of any religion. It's no respecter of any race. Does not respect rich or the poor. Once it comes, it comes. And what does that tell us? As religious people, as people of faith, we believe in collective responsibility. We believe that we are responsible for each other. We believe that we are each other's keeper. We believe that we are all stewards in one way or the other. And if that is the case, it means that it is my responsibility to protect you. And how do I do that? By taking my vaccine. And it is also your responsibility to protect me. How do you do that? By taking vaccine. This sometimes our faith communities don't understand because of so many myths surrounding COVID-19 and vaccine. a lot of people are scared to do that. So the religious leaders, faith organizations, see this as one of their key tasks to educate, to help their people build trust by using our text, by using our religious teachings, to call on our consciousness on the issue of responsibility, protecting one another, being responsible for each other. Taking vaccine is a responsibility. And if I don't take it, it means I am not responsible. So as a good Christian, as a good Muslim, as a good Hindu and Buddhist and the rest of them, we have to do that. So this is the power of our engagement at the interfaith level, by letting people to understand our collective responsibility. So the interfaith basis gives us the opportunity to speak with one voice, be it a Christian, a Hindu, a Jew, whatever you are, we speak with one voice. And what is that voice? We must all be responsible in this. It is a collective effort. All of us must be involved. And how do we do that? One of the best ways to do that is to take our vaccine and then follow all other protocols as given to us by the World Health Organization. So for us, this is key. And then secondly, when we talk about that, it should not just end with talking. We have to build this trust. We have to discuss this in-house, then before ever we start it. Sometimes, example is always better, than just talking to people. As religious leaders, I remember in my own organization, when I was telling our workers, our team to take it, everybody was like, why should I take it? So what I did was that I was the first to go and take it. I went and took it and come back and tell them, hey, look, I've just taken my vaccine. And you see, I have not died, about the myths and all that. So please, everybody should go and take. And many of them responded positively. So as religious leaders, we teach by example, by going to take, and then the followers will now join us. And most importantly, like for instance, in Nigeria, we have seen mosques, churches, and different centers being used as the vaccine center, where people can come and take vaccine. That's another big example, beautiful example, to show people that, hey, look, if this thing is bad, if vaccine is not good for our health, how can faith communities allow them to use their centers, our premises for that? So these are some of the ways we have promoted, vaccine here, Africa, and also all over the world, especially at the basis of interfaith, interreligious collaboration. And I believe that, if we do this more, it will really help us to address this problem more quickly and more effectively, than working separately. By the time we come together, pull forces together, we will achieve more, especially as interfaith people, because a lot of our people do listen to us. A lot of our religious leaders command a lot of influence. All that the faithful need to see is to see them doing what they are saying. And you see a lot of them will respond. And that is the approach that we have been using to help to build the trust, so that more people will go out there and take it. Because without taking it, it means that I am not a responsible and even a good Christian. Because if I really want to protect the other person, if I really want to stay healthy and want everybody, my neighbors, to stay healthy, then I should be the first to go and take the vaccine. And we should encourage them to do that. And that's exactly what we do at the interfaith basis. I don't want the moderator to tell me to stop, so I'm going to stop here now. Thank you.
Thank you, sister. Just in time. Thank you very much. Really appreciate it. So now we are moving to Lebanon. It is my honor to introduce you our next speaker, the Judge Mohammed Abu Zaid, head of the Family Court of Sidon, imam and preacher at Aisha Mosque in Sidon, Lebanon, independent consultant for World Vision International, grow the Islamic adaptation of WVY Channels of Hope COVID-19 vaccine model. Welcome, Judge. My question for you: what do you see as the main facilitating factors to building trust and challenges or barriers that undermine trust in vaccines? Your 5 minutes. there?
I think, Judge Mohammed, you're on mute.
Sorry. Then greetings to everyone from Lebanon. Lebanon nowadays is witnessing a new of the corona infection, and numbers again are going higher and higher. And this is unfortunately because there is a lack of trust between the society, the community, the people, and the government. I will be speaking in a general way, but also taking examples from the Lebanese context. Nowadays in Lebanon, we are witnessing a lot of demonstrations against government and against the corruption in the government. And people are smart. Whenever people call for demonstrations, whenever people call to have any civil action against corruption and against the government, suddenly the government starts to show very high numbers of infections and start to call people not to gather, start to call people to stay at home. And that made a lack of trust. Why, when there is any civil movement against the politicians, numbers are becoming very big, and when everyone is sitting at home, things are okay? Then maybe the government needs any, I'm giving Lebanon as an example, maybe the government in any country should respect the people and should be very transparent in showing numbers, not to use numbers to terrify people, to drive people in the way that the government would like them to be. Then maybe being transparent, showing real numbers, showing real evidences, and being respecting the minds, respecting the citizens. Maybe this is a good action that governments should do. Besides putting ourselves as a role model, then the Prime Minister, the Minister of Health, they appeared on TV in Lebanon and they showed themselves taking the vaccine. And it happened that some people leaked some information saying that they were not taking the vaccine. It was all fake. And that made a lack of, then maybe being trustful and showing are really taking the vaccine and showing that ourselves and our families are taking the vaccine can drive people to me, myself, as a religious leader. I was infected, me and my family, and we stayed at home for a couple of weeks. And later on, I spoke to my community about my personal experience. And when I had the chance to have the vaccine, me, myself, my wife, and everyone in my family, we all gave the vaccine. And I told my community, then putting ourselves, religious leaders, as politicians, as any focal person, in action and receiving the vaccine. And you know, nowadays we have the social media, and tell the people through Facebook, through WhatsApp, through Instagram, whatever, that we had this experience. We took the vaccine because we are convinced, and it is for our own good and for your own good. This also can build trust. Moreover, I can speak about showing positive numbers that after having a certain the country receiving a high number of vaccines, again showing how this caused a reduce in the number of infections and how the situation became better. Showing such numbers also can make other people interested in making their situation better. Then I can say transparency, respect the minds of people, showing real numbers and not fake numbers, and putting ourselves as focal people, influential people, as role models, and receiving the vaccine by ourselves and showing it. I think this can build trust. And we can talk about the opposite. The opposite will cause a lack of trust and will make people still think that it is not important to take the vaccine and that it's all a fake news and it's all a conspiracy and there is nothing called corona. And still we have some people who think this. Thank you.
You really on time. Excellent. We are very committed people. So we are moving now to our third speaker, moving to Geneva. It's a pleasure to introduce you, Dr. Manoj Kurian. He's the coordinator of Ecumenical Advocacy Alliance of the World Council of Church. Dr. Manoj, please. My question for you is similar to that the Imam. What do you see as the main facilitating factors to building trust and challenge or barriers that undermine trust in vaccines?
Thank you, Rabbi. I'll just say that there are three, I'll just consolidate as three main facilitating factors to building trust in vaccines and three barriers. The three that facilitate: one is informed, reliable, and consistent messaging. When the faith leaders are connected and listening to people, and they work closely with caregivers and scientists and health workers to transmit credible and up-to-date information to their constituency in a consistent manner across the hierarchy, that builds trust. The second is value-based messaging, which brings hearts, minds, and hands together. The messages are based usually on values that lift up the agency of people, beyond self-protection, as Sister indicated, values of justice, solidarity, conviviality, caring and protecting others, so beyond protecting oneself, values that give a clarity of vision and motivate people to act. The third is leading by example. The Imam and Sister said they were walking the talk. Leaders, when they visibly take vaccinations and are also opening up and extending facilities to promote vaccinations in collaboration with governments and health authorities, it works. The WCC also has the vaccine ambassadors in these lines. The challenges that undermine, again, three I can consolidate. One is misinformation, as was already mentioned, which includes incomplete information, half-truths, and outright fabrications, which come, unfortunately, from sources and individuals respected by society. The second is superstitious and harmful theologies. Harmful practices often find way into the practice and beliefs of the faithful, and this becomes entrenched when leaders espouse it or are silent on these flawed approaches. The third and final, I think is very important, is that vaccine inequity undermines trust. Out of the 74% of administered COVID-19 vaccines worldwide, which has been given, it has been given in the higher, upper, and middle-income countries, and only 0.07% of doses have been administered in low-income countries. In sub-Saharan Africa, only 6 to 10% of the population have received vaccinations. The delay in the rollout is not only a moral failure, I believe, but it's also a devastating public health, actually, because it is leading to the evolution of mutations, which may substantially reduce the usefulness of current vaccines. So when the poorer communities do not experience the usefulness of science, the great victories of vaccination, they feel targeted. What we have seen, the certain regions of the world are completely blocked out and their livelihoods are gone. And so the trust and the genuineness of public health measures are undermined. Thank you.
Thank you very much, Dr. Manoj. So our last speaker today is really close to me, my neighbor in Costa Rica. It's a pleasure to introduce the priestess Beatriz Schultness. She's the president of Indigenous People Ancestral Spiritual Council and honorary president of Religion for Peace. Welcome, Beatriz. My question for you: can you tell us about some of the ways you have worked to build trust in the COVID-19 vaccines in recent months?
Hello? Yes.
Yes.
Yes. Yes, good morning or afternoon, evening, everyone. Happy Hanukkah to you, Rabbi, your family, and your community.
Thank you.
In the case of indigenous people, it has not been so much work, an individual work, but we do collective work. Since in Meso and South America, indigenous people are not well served by the various health systems, various spiritual guides started to share via networks knowledge and what can be done to prevent and attempt to cure those affected. It works and continues to work. It has really been encouraging to strengthen our networks and also demonstrate basically to ourselves that in some extent we can help us using ancestral knowledge and spirituality. As a board member, on a different level, as a board member of the local development organization in our community, I participate in meetings of the National Council of Emergency in our canton. These meetings are led by and coordinated by the mayor, the regional directors of Ministry of Health, Culture, Police Force participate also. Organizations such as the Shearith, Red Cross, and all the leaders of various communities, development organizations participate. Here again, this is a collective work, and since we serve the whole community, this includes the member of all the churches present in our community, including also non-believers, because there are many non-believers. Vaccination campaigns are being organized and led by the health system. These campaigns are being organized in popular places such as near a supermarket or in the center of a community, in a plaza or something like that. This established system and efforts is implemented throughout the whole country right now. We can see that nationwide the curve is still going up, but the number of recovered people is also going up almost in a parallel way. And that is, of course, a result of the vaccines that have been given. So far, 72% of people have been vaccinated with the first dose, 62% with the second dose. We heard that mid-December, Costa Rica will eventually receive vaccines for the third round. The best way to convince people has always been, at least for me, person-to-person conversation, sharing also my personal experience with the vaccines. That has been, I guess, the most effective. Those that are hesitant can eventually be convinced, but others have complete theories and argument ready. There are many factors that generate mistrust, such as the rapid production of the vaccine, the lack of transparency concerning contracts of the government signed with the pharma companies, fear concerning the composition of the vaccine, on the composition and the long-term effect that it may have. These are the issues which are sort of problematic. Now that it is announced that children need to be vaccinated as well, some parents are fiercely against it, including some who are vaccinated themselves. Here in the country, lawyers have presented various legal actions against different forms of obligation, including the certificate. What is really concerning is that people have sort of lost interest and they don't wear anymore their mask and take care of the measures which need to be taken. In particular, tourists and foreigners, they just come and they disrespect and get very angry when the restaurants and shop request them to respect the safety measures. So I guess this is a little bit what I have to say. That is, thank you for listening.
Thank you, this is Beatriz, and congratulations to all the speakers for the punctuality. I have the same question for all of you. I think in the same order we can answer, 3 minutes for each one. We start with the sister Agatha. So tell me, what lesson have you learned from this process that you could share with others?
The lesson I have learned is that I felt together, unity. Let me just say that unity is strength. Unity is strength, that by the time we work together, it encourages even those who have lost hope or those who don't have the confidence to move forward. For instance, as I said at the beginning during my presentation, I have seen so many people who are so scared, who don't just agree to the vaccine, but for the fact that they have seen their friends, their family members, their leaders, the people they know, for the fact that they have seen them taken and they are still okay and they are fine and all that, it encourages. And that is where the faith basis plays an important role, because it gives people the opportunity to work together as a family, as a community, knowing that this is what we have done for our collective responsibility, and it will help us to move up, forge ahead. That is one of the things I have learned. Then the second lesson I have learned from all this is that I don't have to be discouraged. When you are doing something, definitely, people will come with different ideas to discourage you. People will come with different opinions. So many things will come, myths, stories, and the rest of them to discourage you from, moving ahead with what you are doing. But what I have learned from this vaccine campaign and COVID-19 pandemic is that we don't have to be discouraged, because one or two people or some people have not agreed with you, or some people are not ready to work with you. No, we don't have to be discouraged. We have to move forward because we are convinced of what we want to do, and we know that what we want to do is for the good of everybody. So these are just the two lessons I have learned. Unity in strength first. Unity is the strength, then working together, it answers the whole question. And then secondly, we don't have to be discouraged in the face of challenges and difficulties like the COVID-19. Thank you.
Thank you very much. Sister Agatha, so now is the time to the Judge Muhammad to share with us the lesson how we learned during this process.
Again, greetings to everyone. Maybe the best lesson I learned recently, and that I was even talking about with friends and with my congregation, that we are very weak. This virus, though it is very tiny, though it cannot be seen by eye, but this tiny virus showed how we are very weak as individuals. And if we stand shoulder to shoulder, if we support others as individuals, as communities, as countries, we can face it and we can go over this crisis. Then the cooperation that was between researchers, between those who work in the health sector, with maybe the governments, maybe with the people, in the faith leaders and social actors, all of this cooperation made a real difference. Then weak alone, and we are very strong if we stand together, shoulder to shoulder, and support each other. Maybe this is the best lesson me personally from this crisis.
Thank you very much. Time to Dr. Manoj to answer the question about the lesson.
Thank you, Rabbi. I'll put it in three kind of faith-based words. One is truth, second is love and justice, and the third is humility. When you say about truth, misinformation, ignorance, and fear can only be overcome by accurate, updated, and credible messaging that comes consistently from the pulpits, from the classrooms, from the family, from social media, health centers, and governments, in a language that people can understand, and through the lens of their own context and faith. The truth also has to be lived and be put in practice to build trust, and for each person to lead by example. The second is love and justice. Yesterday was the World AIDS Day, and in the service that we conducted online, Canon Gideon Biam-Gisha from Uganda said that injustice and inequality are two faces of the same coin. So to build trust, we have to overcome injustice and inequality with love, compassion, and empathy. Really acknowledge that we are part of an interconnected whole, one body, the Ummah. We need to see the presence of the divine in the other, however different or distant they may be from us. The third and final is humility. Religious leaders, scientists, health workers, or policymakers have to be humble and accept the fact that we cannot build trust of the community individually. Science, can give us the best tools, but it may not work if the tools are not trusted. So as to bring hearts and minds of people together and get their feet to walk and hands to work, we have to think and act together. We have to listen and learn from each other. And of course, we have to discern the fears of people and not ridicule them. I mean, they may have weird ideas, but you have to really listen to them and respond to their needs. And in doing that together, we have to be accountable to each other and respect each other. So summing up, truth, love and justice, and humility. I think that's what faith communities can teach us. Thank you.
Thank you. Thank you very much, Dr. Manuel. So now the Princess Beatriz, please answer the lesson you learned in this process.
Yes, for me, I guess, again and again, is to see that the strength that as Indigenous people representing a lot of different cultures and languages, working together against all odds is to me always and again amazing. We helped a lot of people right here in Nicaragua and Honduras and different places with the knowledge we were able to share. Even some of us, our people who are sort of resistant to medicines and cannot really be vaccinated also. And on the other hand, personally speaking to persons of different language in the area where I live has been very encouraging and positive. It really shows that collective work, extending the feeling that we are all the same. And I agree with the words of Dr. Kurian before, with love and commitment is really the best tool we can use. Yeah, that is my experience during this pandemic. Mm-hmm.
Thank you. Thank you very much, all of you. As I told at the beginning, we are really enlightened with your things and your ideas. Time to question and answer. Please use the application, the question and answer application in the Zoom to send your questions. First question from Prabhuk. I don't know if I did right. Sister Agatha, it is clear that the faith leaders in this forum promote vaccination quite strongly and rightly so. However, there will always be a number of people who will not feel safe to take the vaccine. What is the role of faith leaders in ensuring that those people are not feel segregated if they do decide to avoid being vaccinated? As places of faith need to ensure that there is no form of discrimination at the end of the day.
Thank you very much for that beautiful question. Yes, I completely agree that faith communities do not uphold discrimination or segregation. After all, that is what we teach. But at the same time, we should understand that every decision comes with a consequence. Whatever decision I have decided to make, or whatever decision you may have decided to make about your life, there might be consequences to it. So, and maybe when the consequences are coming or consequence is coming, we shouldn't, somehow look at it in a very bad way. For instance, I know in my country recently, the government, gave a kind of public notice that from this month, if the government, starting with the government workers, if you don't take your vaccine, you will not be allowed to come to the office. So that is the consequence. So it's either you take it or you are ready to forfeit your job. So and somehow it happens in different ways. I believe that is what my understanding about religion tells me that it wouldn't really be nice to say, okay, if you don't take your vaccine, don't come to church. I don't see any religious leader going to that extent, but still, for government who have said, if you don't take it, you don't come to work and all that. The religious organizations, religious leaders may have the courage to talk to the government. This might not be the best approach to go about it. Let's give them time. With time, they will understand that the vaccine is good for everybody. It is for their own good and for our own good. But don't think that when the religious leaders didn't say anything like that, they have failed in their responsibility of protecting you. After all, you are the one who make your decision. And remember that every decision comes with its own consequence. So that's what I can answer on that for now. Thank you.
If one of our speakers want to add some thoughts in this question, please open. Dr. Manus.
Yes. We are not, I think it's important not to judge. As Sister said, there are consequences, but at the same time, there are public health requirements. So there might be, like in a meetings, you have to have a test negative, you have to wear masks and maintain. So people have different reasons why they don't take. So we don't discriminate. They can still participate, but maintaining the public health the measures. So that is very important, because it's also what we also try to say is that it's not only just to protect yourself, it's also to protect others. So it may be a little bit difficult for us to take the vaccination, but to help and protect others. So it is not, so it's very important that those values are highlighted, but still people may not, and we should respect their decision, but they have to follow the public health measures. So it's not a personal judgment. It's just that we have to make sure that public health measures are followed. Thank you.
Dr. Manoj. Next, I move to the next question to Judge Mohammed. Are there a good example of action taken by faith leaders to ensure equitable distribution of vaccines across the world and within a country?
There is a role for religious leaders to distribute the vaccine. No, it is the government, the Ministry of Health Affairs. They own the vaccines. In Lebanon, the vaccines were received as donations from other countries, and the government received this donation. The government organized giving the vaccines for the public. Faith leaders were just a mediator to raise awareness, to encourage people, and also to put themselves as a role model by taking the vaccine by themselves. No private sector, no religious sector was authorized to give vaccines. It was only carried by the Ministry of Health.
Thank you. Okay, anyone, or I move to the next question. Okay, yeah, Dr. Manoj.
Just to say that, the faith, many faith communities opened up their facilities, to help the government and the health workers to do this. So and also the leaders came forward. So, in all over the world, the mosques and the churches, and so that was provided. So they worked with the government. So in that sense, it was really, the trust was built, and really came, gave that facilitation, because though only the government is authorized, it has to penetrate into communities, and our churches and temples and mosques are there in all the rural areas. So that is very important. So actually, there has been a lot of impact of this we see all over the world. Thank you.
Thank you. I move to the next question from Jocelyn to Priestess Beatriz. What is the main role of religious leaders in increased community trust toward the COVID-19, also the vaccination?
Okay, well, like I said before, the really, for me, the best experience was to speak to people in person, talking to them about my experience. I was vaccinated very early in April, and so try to convince them. I always do things very conscious of who I am and what my faith tradition is, and in where I live, people know me, and they know that also. Throughout the years, I think a certain trust has been developed also on this and many other issues. So I think we have to carry on like that, since here the interreligions aspect is not working so much, because everything is being organized and carried out by the government officials, and some of us, we are being called to participate. So I don't know if I had the question right, but if I need to add something, please remind me what the question was, in case that.
The question is about the role of religious leaders in increased community trust toward the COVID-19.
Yeah, well, I did sort of explain my own. I did see sort of an absence of the rest of the religious leaders here where I live. And mainly not because some of them are living here, but some of them are not living here. They travel in and out for when they have services to do, and they live somewhere else. So they're not always present. So that is probably the difficult. We have not seen so much interreligious interaction here where I live.
Thank you. Anything you want to add? Okay. Yeah.
Yes,
Dr. Manoj.
Rabbi, I mean, the sense from the World Council of Churches perspective, I think our leaders have been making public statements, and both interfaith and also with other communities and individually. That is very important that, that we really state it. So that is important. And pastoral messages, because, it is not only enough to speak to the world, but also the leaders need to speak to their congregation. So we have had pastoral messages and mechanisms of interdisciplinary groups, listening and responding to member churches. So they are multidisciplinary and holistic responses, prayers and reflections. And of course, our leaders are engaging in public discourses and education and dialogue. So all these challenges that you raised have been dealt with, and they are trying to answer. I think interfaith and ecumenical collaboration and collaborations with WHO, because this is very important, and with the religions of peace. Very, very important that we do these things together. But I personally feel we need to do more on vaccine equity, because, if vaccines are not rolled out, really the trust will be challenged. And then people will say, what are you talking about? Who's gaining out of all these things? So it's a very, very serious issue. And I think as faith leaders, we need to do more. Thank you.
Judge Muhammad.
Yes, I will start from that word. As faith leaders, we need to do more. When you introduced me, you mentioned that I did the Islamic adaptation of something called channels of hope and it's about corona vaccine. What is this? It is a methodology that teaches religious leaders how some information about the virus, some information about the vaccine, and how they can use this information to contact the congregation, to guide the congregation concerning the crisis. Maybe the leaders have a lot of influence. Maybe the faith leaders has the mosque, the church, the synagogue, or whatever, as a place where people gather. But do they have the right information? Do they have the right language to speak with people? Then maybe we need to do more as religious leaders, but also we need the help of those who are specialized in this field to give us the information and even to train religious figures how to deliver this information to the public and how to deliver this message to the public. Yes, we need to do more, but also we need the help of World Health Organization, of all organizations that were involved in this issue. Thank you.
I have a related question about that you said. It's a question from Shaidula. Delivering and receiving information should be balanced. How do we ensure that the delivery and reception of information is balanced? Who want to answer? It's a hard question, nobody wants.
If I will respond, I don't quite understand very well what he meant, or what he means by receiving and delivering information. Which information is he talking about? Is it the COVID-19, the vaccine, which I believe is what he's talking about. So receiving it we have already heard from the World Health Organization, about the COVID and how they have certified the vaccines, giving us, how the percentage of its protection on people, safety on people and all that. And that is, for now, the only thing we depend on as faith people, as faith communities. The next and the most important is to back it up with prayers. So we receive that from them, from the World Health Organization, from a different National Center for Disease and Control and the rest of them. And then we give it out because we are not doctors, we are not scientists. We get the information from them. And then we give it out from what they have heard, and trying to balance it, based on our faith teachings and the rest of them. So that is, what I would answer there, because receiving and balancing, maybe I don't quite understand very well what the person mean. Thank you.
Yeah, Rabbi, I think this is the importance of actually working together with the scientists. Like in each faith community has different people of different disciplines. I mean, it's not only the religious leaders. They have doctors, teachers, health workers, nurses, etc. So we need to strategize and work together, having a multidisciplinary team to be able to discern, because there is so much of information, which is also, I think, Shahidullah has raised a point. I mean, there is so much of information that we have to discern what is the reliable information. But a person who is used to receiving it will be knowledgeable, and the faith leader who is able to get it and respond in the right way. So it's a matter of teamwork. I think it is possible if we work together.
Thank you. Okay, our last question for all the panelists is from Bingao. Would any speaker mind to share some data in your work about COVID-19 vaccine implementation? How long you have been working on this intervention? Do you know how vaccination coverage has been impacted by faith leaders' involvement, etc.?
Let me start again. Yeah, I have to be very, very honest here. If I say that I'm taking statistics, of the vaccines and how many people, the number of people I have been able to convince to come and take the vaccine, I would be telling lies, and I'm not ready to do that here. But one thing I know is this, that I've been able, maybe through my faith organization and the interfaith that I represent, especially from the women angle, from the women of faith, from the faith women leaders, I can say that we have really gotten some good number of people who have taken the vaccine, who are also helping to campaign, in different areas on the need for people to go for the vaccine. But to give the accurate or the exact statistics of that at the moment, I don't think I will be in the position to do that. Thank you.
Thank you. Judge Mohammed.
Actually, it is not done by individuals to be able to say that I was able to convince such a number and they were receiving the vaccines and this is the percentage. It is not something was done by faith leaders as individuals. Faith leaders are have own cooperation and delivering the for the society, and every person is going to the nearest health center to receive the vaccine, and then the numbers are there in the health centers. But as a faith leader, I can say what I was able to witness, like the case in the place where I live. I'm the senior judge of the city of Sidon. Then it is not me, the judge, saying this message. It is me, my colleagues, my friends, and other leaders from different faith traditions. We were all doing this work. We were all sending this message and encouraging people. And then the Ministry of Health gave some percentage that inside Sidon, where I live, it is 60 plus, 60 plus were receiving the vaccines. And then we can say it is the work of media, the work of faith leaders, it is the work of all social factors made this percentage 60 plus. It is not only the faith leaders, and no one can give him credit that I was able to convince and I was able to raise the percentage of those who were receiving the vaccine. It is a group work. It is not done by individuals or by one sector. It is a group work and a cooperation between all sectors.
Thank you. Thank you very much, Judge. Mrs. Beatriz or Dr. Manoj, something to add?
Yes, I just want to bring, sorry, after you. Please go ahead.
Yeah. Well, we worked on this since the beginning of the pandemic. In my what I'm concerned is working together with the Indigenous Network on one hand, and then also working together with all the different leaders and heads of institutions at the community level. The numbers are being given by the health system. I mentioned earlier during my presentation some percentages of people vaccinated. Of course, when we work together, like for example, here at the community level with all the different actors, we can only hope that we have some positive impact, but like the previous colleague said, to say how much individually, it's a little bit far-fetched. It cannot be said, yeah.
Just a one sentence in the sense, the qualitative and quantitative data is out there. And so I think it's a great idea, and it's up to you also, to scientific people, youngsters, go out and work with your faith communities and get the evidence. And it's important, because if it is not working and we are not accountable, we need to be challenged. So you need to work together and work towards getting clear data. Thank you.
Thank you. Thank you very much. Thank you very much, Sister Agatha, Judge Muhammad, Dr. Manoj, and Princess Beatriz for your ideas, your thoughts, and your punctuality. It was very, very important, very clear. And thank you, WHO and Religion for Peace, for giving me the honor to be the facilitator. So I move to Sarah, I believe, yes?
Thank you very much, Rabbi Gustavo, and thank you very much for the wonderful facilitation. So indeed, I think we had it was a very strong panel today with many important nuggets of information that we take away with us. I think very clear messages that resonated with me was the strength in unity, and Judge Muhammad, you talked about the transparency and trust in governments. Dr. Manoj, I really liked your comment on needing to, in order to build trust, we need to overcome inequities and injustices. And Priestess Beatrice, I think the very humanness of person-to-person conversations and connections in increasing vaccine confidence. And thank you, everybody, to all our panelists today to be here to share with us. This, as I mentioned earlier, this is the final webinar of our WHO and Religions for Peace co-hosted global conference. There will be a conference report, so please do look out for that. And all conference materials and recordings will be on our website so that you can go back and look at them at your leisure. We are looking a little bit forwards now to next year. We are establishing, and very delighted to say so, a memorandum of understanding with Religions for Peace to strengthen our work and to increase what we can do together next year. And so the signing of this MOU will be the formal closure of this conference, but also a reinforced commitment to take what we have all shared and learned together during the conference forward into the next year. So I wanted to just say thank you to all the presenters, the facilitators, the interpreters, and our EPI-WIN faith communities of practice for all the hard work that they have put into delivering this conference. I'd also very much like to thank Sally and Alex. If you're here, please put your cameras on so we can see you. It's just been a pleasure to work with you on this over the last several months. So I think that is all we need to say. We can close the conference. Thank you to all our participants, and we look forward to keeping in touch with you. Please do send us an email if you'd like to stay in touch. I wish everybody the rest of the day. Thank you for your time. Thank you. Bye-bye, everyone.
Thank you, Rabbi, for the great moderation.
Yeah, thank you, everyone. Have a good day. Bye-bye.
Have a good day. Thank you for getting up so early.
Thank you, Sarah and the team.
Yeah.
All right. Take care,
Sally,
everyone.
and the interpreter.